So my name's Steven. You're from the neighborhood anesthesiologist. What does the anesthesiologist have to do with this virus that we're experiencing and these medical problems that are happening nationwide and even worldwide? So obviously this has been in the news for quite a while, and every day there's new numbers, new information that's being found out and discovered. So I've mostly just been kind of sitting back and taking notes and thinking about how it would affect my clinical practice and affect myself and my loved ones. So I figured I'd come on and clear up a couple misconceptions possibly, and then just kind of give my take, what I'm thinking about what's going on, and then a couple things about how it affects anesthesia and your health and your experience in the healthcare system. So starting off, the current numbers as of tonight, about 167,000 cases worldwide, almost 6,500 patients that have passed away from this viral illness. There's about 75,000 patients that have recovered, so that's good to hear, but there's also tens of thousands of patients that are still critically ill. The virus has been tested for and been found in 119 out of 195 countries thus far. In the US, we have had 3,700 confirmed cases with 65 deaths. The states being hit the hardest are Washington State, California, and New York, which kind of makes sense because of just the dense populations and the travel patterns and all that. Of note, there's still not enough test kits out, so we don't quite have a handle on the situation on who all actually has this illness and who doesn't. The buzzwords we've been hearing have been hand washing, hand hygiene, the benefits thereof, social distancing versus quarantine. Again, the goal with the social distancing is to decrease the rate that this illness spreads and is transmitted. We really want to slow down the spread of this viral illness, and it's transmitted through aerosolization, so you're breathing in germs that have been sneezed or coughed into the air, and then it's also viable on hard surfaces, so you're picking up the virus touching different things, and then touching your face or other ways for the virus to actually get into your body and infect you. So with this social distancing, really it calls for all of us to do our part and do what we can. The concept is, on your everyday grind, you go to work, maybe you interact with 50 people, right? You go into your office, interact with your boss, your coworkers, or whatever, come home, maybe stop for groceries, and then go home. So if in a normal day you interact with 50 people, then the goal here is to maybe try and lessen that interaction. Maybe interact with 10 people or so. Maybe you're able to work remotely, or maybe you go grocery shopping once for the week, and really limits that interaction. On the extreme are those large events, those sporting events, church, the movies, St. Patrick's Day, bar crawls, where instead of interacting with those 50 people that you normally interact with, you're interacting with hundreds and thousands of people, and you guys are all sharing the same air, the same spaces, and it really increases the risk that whatever somebody has, a lot more people are going to get. So we've seen evidence of that from different conferences that people have been to where someone has the virus, and shortly thereafter, a lot of people from that initial group test positive for COVID. So that is the concept. I know, like, over the weekend, a lot of pictures of brunches and people going out like business is normal, and there's pictures of people out on Bourbon Street. It really just takes all of us to realize that, hey, even though we're healthy and young, we really need to stop the spread of this virus any way possible. Disappointed to see on my own Facebook timeline some of my friends that are kind of thinking it's a hoax or a plot by the government. And you know what? If in the next couple months nothing comes of this and it clears up and goes away and it was all a hoax, and I think we would be all better off for it. But in the meantime, we should definitely take all the care and precautions that we can. So as an anesthesiologist, I deal with patients usually having surgery, sometimes critically ill, sometimes just sick. A lot of it, what we do is airway management. So when people have trouble breathing, we place breathing tubes to control their breathing. A lot of the patients that are coming in with really bad viral infections are requiring this invasive ventilation, these breathing tubes to be placed. For people that deal with airway management, so anesthesiologists, nurse anesthetists, emergency physicians, critical care doctors, the American Society of Anesthesiologists, as well as other organizations, have put forth guidelines on how to safely intubate and manage these patients' airways. A lot of it's common sense, so wearing the appropriate PPE, the appropriate mask. It states that the most experienced person should attempt to intubate first. No fiber optic intubations, try not to pre-oxygenate, because we don't want to aerosolize the virus and increase its spread. Those are all available online, so if you're in a situation where if that's you, where you routinely manage airways or maybe called upon to manage an airway, then that's something that's available. You should avail yourself of those guidelines. Furthermore, the Surgeon General of the United States, Dr. Adams, he's actually an anesthesiologist, so he came out over the weekend saying that we should, if possible, delay elective surgeries. There's 3 different types of surgeries, right? Emergent, urgent, and elective. Elective surgeries are, you have a mole that's been bothering you, you want the mole taken off, or, breast enlargements, breast reductions, cosmetic surgeries, things of that nature. His recommendation is to try and postpone those surgeries and not do elective surgeries for now. Overall, we're going to try and offload the healthcare system and offload hospitals so that we are available to treat and see patients that come in ill from this COVID-19. If you are scheduled for your routine doctor's appointment, if you're healthy and you're just there for a routine appointment, you should call your doctor, see if you can have a virtual appointment possibly, or maybe reschedule your appointment a couple months down the road. They can tell you whether or not you should go in. If you're having viral symptoms, the cough, the fever, the runny nose, you should also call your doctor before you come in so they know that you're on the way in. We don't want you coming into an office and then infecting other people if you do indeed have the illness. So what am I doing about the coronavirus? For the most part right now, it's business as usual at work. I'm waiting for the hospital and the anesthesia department to kind of figure out how we're going to address the situation. When it comes to survival items, I actually buy toilet paper in bulk anyway here. So luckily, about a month ago, I bought a big thing of toilet paper. So I'm good in that regard. But for groceries, I did realize that I only have about, 2 or 3 days worth of groceries at the house. So I did go to the store and get about 2 weeks worth of groceries. I spent, $180 at Whole Foods. Canned beans and what else? Some ready to eat meals. I got some meat put in the freezer just in case. What I envision happening is, as people get sick, they're gonna have to call off work, and it'll get to a point where your grocery store can't really stay open as it used to. So maybe hours will be limited, or stores will close, and it'll be harder to get food. So having some food on hand, I think, could definitely help decrease the risk, maybe help keep you more comfortable. I don't think we're going to be rioting in the streets. I think the power grid will be fine. I think water will still run. But I am being judicious with food because I like to eat. And fortunately, I really haven't had any problems shopping for groceries. I think the stuff that I usually eat, people don't get. So surprisingly, the fruits and vegetables have been plentiful. And lastly, I think I am doing a couple of things just to kind of improve my immune system. So taking some emergency tablets or vitamin C or whatever before I go to work every now and then. Other things that you can do to improve your immune system, things I'm working on doing, is maintaining that healthy diet. So eating my fruits and eating my vegetables, cooking more, not eating out. If you do eat out, just get takeout. Just remember that because you're eating out, there's a worker at that establishment that has to work and interact with a lot of people to make your food. Other things you can do to improve your immune system: exercise, sure. Maybe not go to the gym, but run around your neighborhood or get some fresh air. Avoid those communal spaces. Stop smoking. This would be a great time to stop smoking. Don't drink in excess. Alcohol does affect your immune system, and you want it as strong as possible during this time. Get enough sleep. It's something that I usually don't do. So I've been working on getting my 6 to 8 hours of sleep a night. Wash your hands. I know you've heard that a million times. And then just try to minimize different stressors in your life. It's okay to unplug for a little bit. The numbers in the news are just going to keep going up. And everybody's it's a lot of noise right now between politics and all that. So if you need to unplug, declutter, de-stress, just do whatever works for you. I think we're gonna be okay. We'll get through this together. So hopefully this helped. This is I think probably my second YouTube video. Been working on this channel for about a month or so. So a little different than what I really plan on posting on my YouTube channel. But stay tuned for more. If you like it, go ahead and subscribe to the channel. Hit a thumbs up, thumbs down, whatever floats your boat. And again, we'll get through this together. Thanks.